Tonight on Medical Rounds, nearly 60,000 people in Connecticut live with epilepsy every day. There are many different types of epilepsy, and seizures can really come out of nowhere. Joining us now from Hartford Hospital is epileptologist Dr. Schuyler. Thank you so much for being with us tonight, Dr. Schuyler.
Thank you.
Well, let's get started with a general question. What is epilepsy, and what happens when medications used to treat it don't work?
Well, epilepsy is a condition that means that the brain is prone to have unprovoked seizures. So that means without medications or another form of treatment, that a person will go on to have seizures unpredictably. Most of the time, medications are very effective. It's just a matter of finding the right one. But for about 1/3 of patients who have epilepsy, the medications just really aren't very effective. In that case, we have to look into other treatments, such as potentially surgeries, devices, or other medications that might really do a good job in curing the epilepsy.
Well, let me ask you this. That brings me to my next question. When should someone who has epilepsy seek care at a comprehensive epilepsy center? Is it when the medications just aren't working?
Well, that's one great reason to refer somebody to an epilepsy center. In some cases, we're not really sure what someone's diagnosis is. They may have episodes where they lose consciousness and no one sees what happened, or some other funny symptoms where somebody blanks out, or may have unexplained neurological symptoms that come and go, and we really want to figure out what they are. So in some cases, we can monitor a patient in our epilepsy monitoring unit using a test called an EEG. We bring patients in for several days, and we can record the events that they're having at home to really help confirm their diagnosis. We also can monitor patients who do have seizures and the medications don't work to see if they qualify for other treatments which could make it so that they stop having seizures altogether.
What are some of the newest options for treating epilepsy other than medication? Is there anything new out there?
Well, for some patients, when the seizures start in a single focus in the brain, it may be possible for them to have a surgery which can cure their epilepsy altogether. The more advanced surgical procedures, some of them are minimally invasive. There are also some newer laser ablation treatments which can be less invasive and still really do a good job. We also have some devices that are FDA approved, such as the vagal nerve stimulator, which isn't a cure for seizures, but really can help reduce the severity of seizures and their frequency. And that's a device sort of like a pacemaker, which can be placed in a same-day surgery.
That sounds great, and it sounds like there are more options today than perhaps there were in the past. And we thank you so much for highlighting those options and sharing your insight with us, Dr. Schuyler. Now, if you'd like to learn more about epilepsy, just call the number you see on the screen, 855-HHC, HERE, H-E-R-E.